Hello, I'm Dr. Valerie Walker, and welcome to part two of breast cancer awareness. As you learned in the previous episode, and I hope you watched it, please watch the first one, that breast cancer will affect 1 in 8 women in their lifetime, and each year over 218 women are diagnosed with breast cancer in this country alone, and worldwide so many women, and that every 2 minutes, and our producer counted it down for you, every 2 minutes a woman is diagnosed with breast cancer, and it's the leading cancer among women only after skin cancer. So we've talked about breast cancer. We talked about some of the signs and symptoms. Just to recap real quick, a lump, a thickening, an orange peel to the breast with all that little pitting in it, some redness, fire redness to the breast, peeling around the nipple area, anything unusual, a lump that does not go away, a thickness in the breast, something that you're not familiar with, as you look all the time and examine your breast. And I hope you ladies are doing your self breast exam and looking at your breast. These are the things that you want to look forward to. Look forward to seeing if you're going to have any problems with your breast. Now, let's talk about who's at risk for breast cancer. Well, number one, we already said female. So we know females are at risk, and we also said men. So men, don't think you spared. You are at risk for breast cancer also. Another risk for breast cancer is women who have no pregnancies, and that's because you have all this unchallenged estrogen going on in the body for all these years and years and years. That's why the breast cancer rate among nuns are much lower, because they have not had pregnancies. And then it increases with age. A lot of times patients think that diseases decrease with age. Like, oh, I'm getting older now, Dr. Walker. It didn't get me, so it won't. That's not true. Breast cancer increases with age, and like we said in the previous presentation, but when you get breast cancer at a young age, it's usually really, really bad. Okay, it increases when you have a personal history of breast cancer. So getting breast cancer in one breast does not mean it spares the other breast, or that it won't come back in that breast. So if you have a personal history of breast cancer, you've really got to stay in tune with your oncologist and your primary doctor, because you can get it in the other breast, or it can reoccur in that same breast that you've had cancer in before. So the personal history. If you've had radiation to your chest for whatever reason, either as a child or as an adult, any type of radiation to your chest can increase your risk of breast cancer. Also, if you start your menses at a young age, and there again, that's that unopposed estrogen all the time, then you're at risk, especially before the age of 12, then you're at risk for breast cancer. The other thing is hormonal replacement therapy. Oh, in the old days, whenever a lady had a hot flash, the biggest thing they used to reach for is hormone replacement therapy. But hormone replacement therapy has been associated with breast cancer. So there again, you got to weigh the risk versus the benefits. And later on, I'm going to talk about one of my superfoods. And one of my biggest superfoods I love, and I will reveal it. I didn't even show the professor, because we're going to talk about it in another show that we're going to do this morning, is actually celery. And celery actually helps prevent a lot of those symptoms that you're feeling, those menopausal symptoms, all those hot flashes and things that's waking you up late at night and you can't sleep. Eat a lot of celery, and that will help a whole lot. I had a little old lady come up to me in the grocery store one time, and she said, "Baby," I said, "Yes, ma'am." And I'm tall. Most people know I'm tall, and I always attract these cute little old ladies in the grocery store. Usually they want me to get some off the shelf for them, and I do, or whatever. She said, "Your skin is so pretty." I said, "Well, thank you." She said, "You know how you want to keep it pretty?" I said, "Yeah, tell me how." She said, "Every single day eat celery. I went, ma'am? She said, every single day make sure you eat some celery. She said, celery is good for everything. She said, it's a diuretic, so it's good for blood pressure. It's good for your skin. So just find a way to incorporate celery in all that you do. And I'm inviting all of you all to do the same. I chop up celery and everything. Soup, egg, oh yeah. I'll scramble some eggs and dump a little chopped up celery in those too. Tastes wonderful. So just try to put a lot of celery in your diet, because you're going to see is another show we're going to do that. It's called You Are What You Eat. Celery is a very important nutrient in your life. So we kind of cut back on hormone replacement therapy, and what we found out when we come back, the mortality is just a little bit better with breast cancer, and the death rate is down some with it. And a lot of the experts, when you read about it, they think it's because we've cut down on hormone replacement therapy and trying to offer the ladies something more natural to do when they get those old unbearable menopausal symptoms. So menses at a young age, no pregnancies, biggest family history, and all of those things, and the increase with age increases your risk of getting breast cancer. And that's why it's just so important to always check with your doctor, do your self breast exam, and make sure you stay updated on mammograms or whatever test you and your doctor decide that you need to get to try to put this disease at bay. Then you need to do it, because this is one of those things where prevention is much, much better. And talk to your doctor about the screening. Ask your doctor, how often do you want me screened? Because it may differ from you than someone else, because if one patient has that strong family history, their screening may be more often than a person who has no history of breast cancer in their family. So there again, always make those appointments with your doctor where you can sit down and talk to them about prevention sometimes. Not let the disease get you and go, oh, what kind of pill am I going to take? There's not a pill for every ill. Just trust me on that. So the biggest thing now is still early detection and prevention. And what you want to do too is also do your self-breast exam. Ask your doctor. We usually have little cards and stuff how to do it, but you usually work your way out of the breast and toward the nipple. It's just like a clock. And there again, you're not trying to make a diagnosis. What you're trying to do is feel and see if you feel something that you never ever felt before that warrants you making that appointment, and then your doctor check it out. Another thing you want to do when it comes to prevention is you want to make sure that you're always eating a healthy diet. You are what you eat is absolutely right. You know why? Because breast cancer is also associated with obesity. Yes, it is. So if you eating wrong and all, because a lot of the hormones are synthesized from cholesterol and all, and that's a whole nother show. We won't even go into that today. But you need to know that it's associated with obesity. Alcohol, if you just goozling your little alcohol all day long, remember my rule, one a day if you must drink for women, and no more than 2 drinks a day for men. So 1 and 2. 1 for the women and 2 for the men. So you want to watch that alcohol intake. You want to exercise. Make sure you stay active. An object that's in motion tend to stay in motion. An object at rest tend to stay at rest. So if you lay on that couch potato and don't do anything, have you noticed when you get up, you can't hardly move, you can't hardly walk around. But once you get going and you stay going, you keep going. So ask your doctor based on your health condition. Always from this show, learn you want to check with your doctor to see what's your health condition, because everybody got different things going on. Some people have heart disease, kidney disease, high blood pressure, different things going on. So talk to your doctor and ask them specifically what can you do. And for most of my patients who are basically well and can walk, I tell them I would accept just a 30-minute walk 4 to 5 times a day, a little brisk 30-minute walk. We found out walking is one of the best exercises you can do. And guess who walked everywhere he went most of those 33 years that he was here? Jesus. Yeah, so let's get out there and let's walk some. Make sure you stretch before you start, and start off slowly. Don't jump out there. If you know you have not exercised in the last 20 years, why are you jumping out there trying to run a marathon? Okay? and wonder why you didn't make it but a couple of blocks and now you're on the sideline huffing and puffing, okay? So just make sure you do the exercise that's conducive for you. Start off slow, ask your doctor what they want you to do, and they'll give you a good exercise program. And I know that walking and stretching is one of the best things that you can do. If you smoke, you want to quit. Smoking is the number one cause of preventable death in this country. When you smoke, you're literally just nailing your coffin. You're nailing your coffin. We've isolated so much stuff in cigarette smoke. We've isolated arsenic, embalming fluid, so you waking up feeling stiff every day, it could be them cigarettes. And no, nobody's trying to kill you with the embalming fluid. It's those cigarettes. So all kind of things in the cigarette. So try to decrease the alcohol, the smoking. You want to exercise and you want to eat right. And those are some of the good preventive things that you can do to decrease your chances of getting breast cancer. If you do get breast cancer, then in conclusion, what are some of the treatments? Well, we got all kind of things that we're doing now. Some is called a lumpectomy, which is just removing the area. Like I told you about Nancy Reagan earlier, that's in question and watching it, and the doctor may or may not want to do radiation and therapy. Prophylactic mastectomy, like Angelina Jolie, get it done and be done with it, and that decreases her risk because she says she wanted to be around for her children. The doctor may recommend a whole mastectomy, and that's the complete removal of the breast, followed with, there again, depending on those lymph nodes. Didn't I tell you the lymph nodes drain areas? So we would always check them. So depending on the lymph nodes, they would either recommend some kind of radiation or chemotherapy. And then we have things like hormone therapy, targeted therapy, and these are therapies that target areas of the cancer cell and go right in and try to do the kill. And we have radiation therapy, chemotherapy, and surgery. And again, all that's going to be a decision that you're going to make with your family and with your doctor, and to be comfortable with yourself. Of what decision you're going to make concerning breast cancer. And it's always going to come back to what we talk about: early detection for the early cure. So that is our discussion on breast cancer. I hope you enjoyed it. I hope you realize you got to look at your breasts. You got to check them. If you feel anything unusual, you want to talk to your doctor about it. We got all types of surgeries and things that we can do that's compatible for you and your lifestyle. And make sure you talk to your doctor about your breast care and concerns. I'm Dr. Valerie Walker. Thank you so much for joining me to talk about breast cancer and breast cancer awareness. We have walks that Susan B. Coleman. We got Sister Strut that I love to participate in, and all these things that go on to increase your awareness, and we will continue to do those type of things. And I will see you next time on The Medical Moment with Dr. Valerie Walker. Stay safe.